Mundial para la Prevención de Ahogamientos del 2026, bajo el lema de la campaña Unidos para cambiar el rumbo. Mi nombre es Alessandra Cenice, consultora de la Organización Panamericana de la Salud, y tendré el gusto de acompañarlos como moderadora durante esta sesión. Antes de comenzar, quisiera recordarles que este webinar cuenta con interpretación simultánea en español e inglés. Y si desea escuchar la sesión en el idioma de su preferencia, solo debe hacer clic en el icono del globo que encontrará en la barra inferior
that
de
you will
Zoom
find
y
on the lower
selecciona el
part of
idioma que
Zoom
le corresponde.
to select the language of your
Asimismo,
preference.
quiero recordarles amablemente a nuestros
I
ponentes
would also like
que al
to kindly
finalizar su
remind our
intervención,
speakers
por
that
favor apaguen
at
sus
the end of
cámaras
their
para
presentation,
facilitar el
please to turn
desarrollo
off
de la
their
sesión.
cameras to facilitate
Para
the
comenzar,
development of the session.
quisiera
To begin, I would like to
compartirles nuestra agenda. En el día de hoy vamos
share
a
our
tener las
agenda. Today,
aperturas de Rebecca Babinger,
we'll
la
have
líder
opening words
técnica
from
en prevención
Rebecca
de ahogamientos
Babinger,
de
the
Bloomberg
leader,
Philanthropies.
technical leader from
También vamos a
Bloomberg
tener
Philanthropies.
las palabras de
In drowning
bienvenida de
prevention,
Dr.
we'll also
Ricardo
have
Pérez Núñez,
welcome words from Dr.
seguido
Ricardo
por
Perez
los
Nunez, followed
avances del
by
Programa Mundial de OMS
progress
para
from
la
the
prevención de los
WHO
ahogamientos.
program
Y continuaremos con
for drowning
presentación
prevention,
sobre la
and
iniciativa
we'll carry
regional
on
del
with a
Caribe. Y
presentation on
finalmente
the Caribbean
escucharemos tres
Regional Initiative, and
experiencias
finally we'll hear
nacionales de
3
Brasil,
national
Colombia
experiences
y
from
Ecuador.
Brazil, Colombia, and Ecuador.
Y si el tiempo nos permite,
And
también
if time
abriremos un
allows, we'll
espacio para
also
poder
open up
tener
a
preguntas
space
y discusiones.
for questions and
Sin más
discussion.
preámbulos,
Without
vamos
further
a
ado,
comenzar
we're going to begin
escuchando las palabras de apertura de Rebecca
hearing
Babinger,
opening remarks from
líder
Rebecca
técnica de
Babinger,
prevención de
technical
ahogamientos de
leader in
Bloomberg
drowning
Philanthropies.
prevention from
Ella
Bloomberg
es una gran
Philanthropies.
impulsora en el tema de prevención de
She's a leader
ahogamientos
in
y
drowning
lesiones
prevention
no intencionales. En este
and
momento ella se
unintentional
encuentra
harm.
de viaje de misión, pero
She's currently
amablemente
on a
nos ha dado
mission
un
travel,
video de
but she
bienvenida.
has provided us a welcoming video.
My name is Rebecca Babinger. I'm with Bloomberg Philanthropies. And on behalf of Michael Bloomberg, the World Health Organization's Global Ambassador for NCDs and Injury Prevention, we are so pleased to have supported the World Health Organization in developing this new technical package to prevent drowning. Protect offers governments and policymakers with best practice recommendations for policies and regulations that will ensure the drowning risk is reduced in their country. We're here in Ghana this week to launch the package and to support the government that's already making great progress in terms of reducing their drowning burden with lifeguarding and with swim instruction. We're off to see some of those sites right now, and we can't wait to see what countries around the PAHO region do with this new technical package. Congratulations. And again, we're looking forward to seeing the country progress in the PAHO region. Thank you.
Perfecto, muchas gracias a Rebeca por este mensaje de apertura.
Thank you so much, Rebecca, for these opening remarks. And continuing with our agenda, I hand the floor to Ricardo Perez Nunez, Regional Counselor for Road Security and Preventable Harm at PAHO, who will give us a welcome to the webinar. Thank you so much.
Gracias, estimada Alessandra, por tu invaluable apoyo en la organización y
Thank you
coordinación
so
de
much,
este
Alessandra,
seminario.
for coordinating this
Quisiera iniciar
seminar.
agradeciendo mucho
I'd
a
like to
Becky por
begin
su amable apoyo
thanking
brindarnos
Becky and her
mensaje de
kind
bienvenida.
support in
Me
these
parece,
welcoming
además
remarks.
agradecemos pues el interés que ha tenido la
We're also
filantropía de
thankful for
Bloomberg
the
en apoyar
interest
el
from Bloomberg
trabajo de prevención de
Philanthropy in
ahogamientos a nivel
supporting
global y regional.
drowning prevention work globally and
Miembros clave de
regionally
la Alianza
as
Global de
key members
Prevención de
of the Global
Ahogamientos.
Alliance for Preventing
Gracias
Drowning.
a ello, como organización hemos sido
Thanks to
capaces
that,
de
as an
avanzar en
organization, we've been
distintas
able to advance
direcciones y nos da gusto
in
saber
different paths,
que tienen
and
interés en conocer el trabajo
it's a
que
pleasure to
desarrollamos
know
acá y
that you're
conocer otros
interested in
países
the
de la región.
work we're carrying
Y
out
aquí quisiéramos
that is
resumir un
underway in
poco
different
la
countries in the
historia de la
region. And here we'd
Agenda
like to
Global de
summarize
Prevención de
the
Ahogamientos,
history of the global
podríamos
agenda
pensar
for
que,
drowning prevention,
pues, que
where
estábamos
we
en un
might think
proceso de construcción. Es
that
la
is in
primera
the
etapa en la que la
process of
organización
being built. The
tuvo
first
oportunidad de
stage where
caracterizar
the
de mejor
organization had
forma cuál es el
the
problema,
opportunity to
desde la
better
magnitud de los
characterize
ahogamientos y a
the
quiénes
issue
afecta más,
from the scope
hasta
of
los
drowning
factores
and
que
who it affects
incrementan o
more,
reducen el
up
riesgo de
until the factors
ahogamientos.
that increase or
Se
reduce the
publicaron
risk
un
of
par de
drowning.
informes globales en 2008, uno
And a couple
enfocado en
global
población
reports were published
infantil,
in
en
2008,
2014
focused on the
más
child
en
population,
general.
in 2014 more in general.
Posteriormente hubo todo un esfuerzo por
Later, there was a
identificar qué
whole effort to
funciona y bajo qué
identify what
circunstancias
works and
funciona
under
mejor.
what circumstances it works
Se
better.
publicaron algunas guías de implementación en
Some implementation guides were
2017, en
published in
2021.
2017, 2021.
Entonces, no solo sabemos cómo
So
resolver esta
not only
crisis,
do we know how to
sino
resolve
que
this
en el
crisis,
Inter, las
but
autoridades de los países
in the
reconocieron la
midst,
prevención de ahogamientos como un tema prioritario a
countries
nivel mundial
acknowledged drowning
y
prevention as a
adoptaron el
priority issue
compromiso de
worldwide, and they
avanzar
adopted the commitment to
a través de
advance
una resolución de la Asamblea General de Naciones
to a
Unidas en
General
2021
UN
y
General
otra a la Asamblea
Assembly
Mundial de la
resolution in
Salud en
2021 and another
2023.
from WHO in
En un tercer
2023.
momento, logramos documentar
And
de
the third
forma
point, we were
integral
able
cómo estamos
to
a nivel
comprehensively
global y
document how we're
regional.
standing globally and
La
regionally.
OMS publicó un
And
informe mundial en
WHO published a
2024 y en
global
COPES
report in
también
2024,
publicamos
and
un informe
PAHO,
regional
we
y lo
also
difundimos precisamente
published one, and we
hace un año
disseminated
durante un seminario
1 year
virtual
ago during a
donde
virtual
colegas
seminar
brasileños
where
compartieron el
colleagues from
trabajo que
Brazil
desde un
shared
organismo
the
no
effort
gubernamental, Sobrasa, con importante
from
liderazgo local,
Sobrasa, a
han tenido
non-government
la
entity with
oportunidad de
important
impulsar
global
en torno al
uh,
rescate
local
acuático en
leadership.
distintas
They've been
partes del
able to
país.
foster
Y el trabajo que
aquatic
autoridades del
rescue
Secretariado
in different
Técnico del
parts of the
Consejo
country. And
Nacional de
another
Prevención de
thing is
Accidentes de la Secretaría de Salud de
efforts
México
from the Health
han
Secretary of
impulsado desde
Mexico
2015 para
has
prevenir
fostered since
ahogamientos en
2015 to
población en la
prevent
región.
drowning in vulnerable
Y
populations.
este informe regional nos
And this
permitió
regional
identificar
report allowed us to
brechas o
identify
ciertas
gaps
partes de lo que
on different
consideramos debe
parts of
ser un
what we
sistema
consider
integral de
should be
prevención de
a
ahogamientos.
comprehensive drowning
Y a
prevention
partir de la
system.
identificación de estas
And
brechas,
based on
hemos
identifying
buscado
these gaps,
promover la
we've sought
priorización de acciones
to
locales y
promote
regionales.
prioritization of local and regional
Y a este
actions.
respecto, el año pasado,
And to
la
this regard, last
OPS y
year
la OMS
at
en
WHO,
coordinación
PAHO, in coordination,
organizamos un taller con autoridades de
we
distintos
organized
países
a
de la
workshop with
región en la
authorities from
ciudad
different
de
countries of the
Bogotá,
region in
Colombia,
Bogota,
que
Colombia,
apoya esta reflexión
which
conjunta.
supports this joint
Y hoy
reflection.
tendremos el gusto de
And
que
today we'll have
colegas
the
de
pleasure
Colombia y
that
Ecuador nos
colleagues from Colombia
compartan
and
su
Ecuador
experiencia y
will be sharing
reflexiones
their
sobre qué han
experience and
podido avanzar
reflections
a
on
este
what they've been
respecto
able
desde
to put
entonces.
forth
Ahora
on this
estamos
regard since then.
entrando en una cuarta
We are
etapa.
now getting into a fourth stage.
Contamos ya con una estrategia
We
mundial
now
de
have
prevención
a
de
world
ahogamientos
strategy for drowning
que busca
prevention,
unir a una
which
audiencia
seeks to
diversa,
join
multisectorial,
a diverse
con
multisectorial
múltiples partes
audience with
interesadas
many
mediante objetivos
parts
compartidos
of
y un esfuerzo
interest
colaborativo y
via shared
coordinado
goals and a
para abordar
collaborative,
el desafío de los ahogamientos en
coordinated
todas
effort
sus formas.
to
La
prevent drowning in
estrategia
all its
ofrece
forms.
un
The
abordaje que
strategy
abarca desde lo
offers
global hasta lo
engagement that
local,
tackles from the global down
situando
to
a
the
las personas
local,
y a las poblaciones
placing people
afectadas
and
en el centro de todas
populations
las
affected at the
decisiones.
center of all
Y
decisions.
precisamente el día de ayer
And
también se
precisely
lanzó
yesterday,
a nivel mundial el
also,
paquete
there
Protect,
was a global
sobre
deployment
el
of
que
the
tendremos
Protect package
oportunidad
on
de
which we'll
escuchar con
have the
más
chance
detalle
to
en la
listen
participación de mi colega
in more
Caroline,
detail with the
quien lideró el
participation of my
desarrollo de
colleague
esta
Caroline,
herramienta
who
al
led
interior
the
de la
development of this
OMS,
tool within
gracias también al apoyo de la
WHO,
Alianza
and
Mundial
thanks
para la
also
Prevención de
to support from the
Ahogamientos
World
y
Alliance
de un
for Drowning
amplio grupo de
Prevention
expertos en el tema que
and a group of
acompañaron este
experts on the
proceso.
matter that accompanied this
Esta
process.
herramienta permitirá apoyar a los países
This
para
tool will allow
implementar
to support
acciones
countries to
clave
implement
a
key
gran
actions
escala,
on
buscando
a
que
large scale,
articulen una respuesta
seeking to
integral y
articulate
sostenible
a
en el ámbito
comprehensive and sustained
local,
response in the local
usando
domain,
el aprendizaje y las experiencias de
taking
quienes han
learning and
podido avanzar en
experiences from those who
contextos
have been able to
bastante
advance
similares.
in similar
Y eventualmente
contexts.
tendremos que
And
medir el progreso en
eventually,
los
we'll have to
países.
measure progress in the
Sería
countries.
fascinante que como
It would
región
be fascinating that as a
pudiéramos
region,
avanzar de manera
would be
significativa
able
y que
to
esto
advance
quede
significantly
evidenciado
and
en los
for that to
siguientes informes que
be
podamos
made
hacer.
evident in
El
following
webinar que organizamos el
reports.
año pasado en torno a este
The
día
webinar we
fue el
organized
primero
last
que
year
como Asamblea
regarding this day,
Regional
which
hemos
was the
tenido la
first
oportunidad de
that we
organizar.
had as a region.
A la fecha hemos
To this
podido
day,
avanzar esta
we've been
agenda
able
y
to
hoy
advance
el
on
doctor
this
Steve
agenda, and today
Bierman
Dr.
tendrá la
Steve
oportunidad de
Bierman will
compartir
have
con
the chance to
nosotros
share with
el
us
trabajo próximo que estará impulsando la Real
next
Sociedad de
efforts that
Salvamento
the
del Reino
Royal
Unido en coordinación con OMS y OPS y que
Rescue
esperamos
Society
contribuya
UK
también
will
a
be
estimular y
deploying in coordination
fortalecer
with
estos
WHO
esfuerzos en distintos
that we
países
hope
del
will help to
Caribe.
strengthen these efforts in different countries of the
Quisiéramos,
Caribbean.
pues, que este seminario virtual
We would
siga
like to then,
estimulando a
for
otros
this
países a que avancen
seminar, to continue
en el
stimulating
apoyo a
other
las
countries to
oficinas de
continue
OPS OMS
advancing with
en
support
sus
from
países.
WHO PAHO offices in their countries.
Avanzar requiere de todos
Advancing
nosotros.
requires
Por ello,
from all of
en
us.
torno a la conmemoración del
Therefore,
Día Mundial de la Prevención de
regarding the
Ahogamientos, que
collaboration
se
of the
celebra todos los
World
25 de
Day for
junio,
Drowning
te
Prevention
invito a que
celebrated
reflexionemos e identifiquemos
on
cada uno de nosotros desde nuestra
June
propia
5th,
experiencia y
5th every
posición,
day,
cómo
we invite
podemos
you to
sumarnos y
reflect from your
aportar
own experience and
para
position how we
unidos
can
cambiar
join
el rumbo.
efforts
United to
to
turn the
change the
tide.
path.
Muchas gracias, Alessandra. Paso la
United to
palabra.
turn the tide. Thank you so much, Alessandra. Back to you.
Muchas gracias, Ricardo, por estas
Thank you so much, Ricardo, for your words.
Siguiendo con nuestro
Moving along
nuestra
with
agenda,
our agenda,
quisiera ahora compartir
I would now like to share
presentación de Caroline, nuestra colega de OMS,
Caroline, our
nos ha dado su
WHO
presentación
colleague's
en video, ya que ella
presentation.
está también
Great.
en un viaje de misión en Ghana.
who's given us a video presentation. She's out on a mission in Ghana. She'll be discussing the WHO program.
Hello, my name is Caroline Lukasik and I'm the Technical Officer for Unintentional Injury Prevention at the World Health Organization headquarters. I'm absolutely delighted to be here today to speak to you about WHO's global program on drowning prevention, share some recent milestones, some progress and our next planned steps. As an overview of today's presentation, first I'll speak to the Global Alliance for Drowning Prevention, then I'll touch on the global strategy for drowning prevention. And lastly, I'm very excited to share a brand new technical product WHO have just launched a few days ago, the Protect Technical Package for Drowning Prevention, which is targeted at policymakers. So to start, please let me go back and speak about the Global Alliance for Drowning Prevention. I'm sure many people are very aware or familiar of this alliance. It was established in 2023 and it's hosted by the World Health Organization. We as an organization have been asked to establish this alliance through both the United Nations General Assembly resolution adopted back in 2021 and also the more recent World Health Assembly resolution for drowning prevention adopted in 2023. The key mission of this alliance is to support global collaboration and enhance multi-sectoral coordination for effective, sustainable and cross-cutting drowning prevention efforts. The idea behind this alliance is to really bring together strong actors working globally, focused on very different areas and aspects of drowning prevention to make a really cohesive, coordinated work plan for the global drowning prevention community, for governments, communities and individuals as well. So membership as of July 2026, you can see it's quite a diverse membership. We have a number of United Nations agencies also members. So this includes UNICEF, UNDP, IMO, FAO, and I think for this stage already you can sort of understand the broad scope of drowning risk factors that this alliance actually addresses. And then we have a number of non-government organizations who work in much more of a regional or a global capacity, specifically to address drowning prevention. We have a number of academic research institutions. We have some global donors. We have a number of implementing partners who work more at the regional level. But again, I think you can admit, you can straight away see the large diversity of expertise and the diversity of areas and topics that each of these different organizations cover. And in fact, when you do start to map out the different skill sets and expertise of the individual members, you can see we cover quite a large range of area. So we cover topics such as maritime safety through to child health and well-being, to child rights, infrastructure, disaster preparedness, disaster risk reduction, lifeguarding, search and rescue. You can see here the breadth of the topics that we cover is really quite impressive and quite large. So as we were forming this alliance in 2023, we were really considering what type of value could this type of global alliance bring to global drowning prevention efforts. This is the only global alliance exclusively focused on drowning prevention. And a lot of our members don't actually have drowning prevention as one of the core mandates, but we have brought them in, especially to draw on their expertise on specific risk factors for drowning, which they are specialized in. We believe that this alliance will have and has policy influence. And through its membership, we believe we have a legitimacy to play the role of the voice of drowning prevention within international policy. And this is really supported by the large number of UN agencies we have as really active and committed members. Global coherence through the global strategy for drowning prevention, which I'll present in my next few slides. The Alliance has the potential to systemize, encourage and support coherent in-country, regional and global action. Again, the key purpose of this Alliance is to bring together actors to standardize our efforts and to really help in our coordination and collaboration together. Also, a really big strength of the Alliance is the multi-stakeholder approach that we have. Again, we hope to leverage resources from a number of different sectors, from a number of different cross-cutting agendas to pull them all together and bring them towards this goal of drowning prevention. Whether an Alliance member is focusing on disaster risk reduction or early childhood development or maritime safety, we hope to leverage these different commitments and funding streams available within these areas of work and redirect them and pull some of this funding towards specific drowning prevention initiatives. So the Alliance is structured around 4 key action groups, and we believe that these are sort of the key priority areas that should be addressed through a global drowning prevention network. The first action group is focused on integrating drowning prevention within adjacent development agendas. And these are some of the agendas I mentioned earlier. We're looking at the role drowning prevention contributes towards climate resilience, towards improved health and well-being, towards better, safer transport over water, towards achieving various SDGs, towards achieving the Sendai disaster preparedness framework. Again, we're trying to understand how drowning prevention fits within all these spaces and can leverage the resources, expertise, and tools available in each of these large topics. Secondly, the second action group looks at strengthening advocacy for political leadership and public engagement on drowning prevention. This is really about promoting the issue of drowning prevention, explaining the true burden and the true context and impact that drowning has globally, and moving it beyond this very siloed, at times obscure topic, and really helping policymakers, non-government organisations and communities understand the broad-reaching impacts it has. The third action group is focused on data and research, specifically on developing a research agenda that addresses current global priorities. There has been an exponential increase in drowning-related research over the last 20 to 30 years. We've seen this stemming in various academic institutions around the world. Some of these institutions are clustered, often in higher income countries. And through the Alliance, what we would like to do is develop an agenda of research priorities that are nominated by different actors working in communities that require the data to take to their policymakers to be able to make a case for drowning prevention. And we hope that through having this list of priorities, we can connect academics and research institutions, support with funding applications to, again, make real impact, make sure that there's research being conducted that has a really clear purpose, that's very intentional, and can be used instantly to feed back into policy and program development. Finally, the fourth action group was focused on the development of a global drowning prevention strategy, which I mentioned in my previous slide. I think this is a really nice way to move into discussion on the strategy itself. So this global strategy was the first key milestone output of the Global Alliance for Drowning Prevention. And we launched this last year in November at the World Congress for Drowning Prevention, which is held in Sharm el-Sheikh in Egypt. And this is the first global strategy for drowning prevention that's been developed and that's been launched. The vision is very strong. It's a world free from the burden of drowning. The objective, again, is to really build and sustain country-level momentum to reduce drowning risk and build resilience. And to do this, we've divided the strategy into 3 key focus areas. The first is people, addressing vulnerabilities according to life stage and population. The next is places, addressing hazards around the home and immediate surroundings. And the last is context. So this is addressing exposures linked to everyday activities, transport, recreation, floods, disasters, etc. A very important component of this strategy is that it has a global goal. It aims to unite to reduce drowning by 35% by the year 2035. So it's a 10-year strategy with a very ambitious goal to decrease global drowning rate by 35% over a 10-year period. This is the first time globally we've had a consolidated shared goal that we're all going to be working towards. So again, this is a very exciting, quantifiable target that we'll be monitoring and tracking over time. There are a number of guiding principles here that really drive the recommendations within the strategy, and it's available for download using the QR code here. So a little bit more about the strategy. There are 6 strategic pillars. This is more around how we want to work and in the areas that we believe need greater investment for impact. These span governance and leadership, multi-sectoral collaboration, data and reporting, advocacy and awareness, financing and resources, and research and innovation. And we believe these 6 strategic pillars will underpin true, sustained, large-scale progress in drowning prevention globally. A little bit more concretely, and these are very sort of practical, programmatic areas of work, we have 10 priority interventions that the strategy aims to address. So again, in the very center of this, we have the distinction of people, places, and contexts. On the outside, we have the 6 key strategic pillars, and then we have our 10 priority interventions. And you can see again, these span a wide variety of drowning risks, from work to disaster risk reduction, to legislation for safe travel over water, to occupational safety, to communication, supervision of children, to infrastructure. They cover a very broad range of drowning risks. But each of these 10 priority interventions is a very simple 2-page spread with recommendations on how true progress can be made on each of these areas over the next 10 years. And in fact, there are very clear actions recommended for each of these interventions for global actors, for countries, communities, local NGOs, and all the way down to individuals. So this strategy is very much relevant from that global, multilateral, organizational influence all the way to individuals in communities around the world. So as I mentioned, this is a 10-year strategy. We are fully committed to tracking progress and achieving this quantifiable target of a 35% reduction in drowning rate over time. We have an entire tracking, monitoring and evaluation plan set out for the strategy. Phase 1, again, is to really build momentum, create partnerships, plans, really understand what our baselines are. We've had the Global Status Report for Drowning Prevention released in 2024. This provides us a very concrete baseline where we're starting from. And then the entire from 2025 to 2029, our focus will be really focused on building momentum and leveraging commitment on getting stakeholder and partner buy-in to this 35% reduction and to the various areas and approaches listed through the strategy for operation. We have a very important midway point. So halfway through the strategy, 5 years in, we are planning a global consultation process. This will be the first midpoint review of the strategy. We'll see what progress has been made to date. We also plan to bring together governments and government representatives to review our progress, to see where gaps persist, to see whether any changes need to be made to the strategy for the final 5 years of its implementation. But very importantly, we hope to seek formal government endorsement of the strategy at this point, which would make it a formalized global commitment. So again, for this to happen, we really do need the support of all of our partners, whether you are an NGO, a policymaker, or a member of a community that is impacted by drowning. We need to create a lot of noise. We need to create a lot of attention onto this issue, because we do really want that formal government buy-in. Because with that formal government buy-in, often comes funding, often come resources, often come focal point nominations, things that we really know are really important for sustained and large-scale action. The final part of my presentation is to introduce the new technical package to you for drowning prevention. I mentioned this status report earlier. In 2024, WHO conducted the first global situational assessment on drowning prevention. This report showed us a lot of really fantastic findings. We saw a lot of interventions are being implemented in a number of different countries around the world for drowning prevention and evidence-based interventions. But what we found was lacking was a very much policy and legislation. We know they're very powerful tools, but they're definitely underused at this time. So we found a number of countries, policy and legislation have very high coverage, but they vary greatly in their contents and their structure, and they often not extremely comprehensive. There's a lot of wiggle room. There's a lot of ways to sort of not deliver on enforcement and long-term implementation. In other cases, there is just no legislation at all to begin with. This really highlighted the need to us for it to develop a best practice guidance on policy and legislation to help build environments that promote safety around water and aid in drowning prevention efforts. So to develop these environments that really promote the implementation of these evidence interventions and ensure their long-term sustainability, ensure their scale, and ensure their impact. So a couple of examples here from the Global Status Report that I can share with you today. So these are some examples of where existing policies for drowning prevention just don't exist. So one of the questions in the status report asked what proportion of countries have a national disaster risk management policy that addresses drowning risk. And 69% of countries, and we had 139 countries participate in this assessment, did not know or did not have such a policy. Another policy-related question we asked is what proportion of countries had national laws on swimming pool fencing to prevent unsupervised child access? Again, a large 86% of countries globally either didn't know or did not have this type of legislation in place. The next example I gave was where there are existing policies, but they're not essentially very comprehensive, which may mean they're not very effective. One question in status reports asked what proportion of countries had laws setting minimum safety requirements for domestic passenger vessels. So it's largely ferries traveling within countries. And 78% of countries had national laws to ensure ferry safety. When we did a really in-depth analysis of these pieces of legislation, we found that of these 78% of laws, only 52% had requirement to respect maximum passenger carrying capacity, just 44% required periodic safety inspections, 38% required vessels to have specific life-saving equipment on board, only 30% required training of people working on the vessels, 17% had a ban on boarding crew or passengers with state of intoxication, and et cetera, et cetera. We could really see that although these laws were present, there are a lot of very important details missing that will really ensure that people are kept safe from drowning. And so with this, WHO, with the support of Bloomberg Philanthropies, undertook the challenge of developing a policy-maker guidance to be able to develop very strong policy and legislation for drowning prevention. And through this package, we really wanted to optimise and standardise the human safety components of both new and existing legislation and policies relevant to drowning prevention. We wanted to consolidate relevant guidance produced by our partner UN agencies. Again, recognising there are a lot of conventions and recommendations and commitments that have been adopted from other UN agencies that are extremely relevant to drowning prevention. We wanted to very much enhance the consistency of interagency technical support to countries. So as we are responding to requests from countries to improve policy and legislation, we wanted to strengthen how we work across the UN, but also with our international partners and organisations as well. So our key challenge, of course, was that the policy space is extremely busy and extremely crowded, and there are always a large number of competing priorities. Drowning prevention is often viewed as quite a vertical program. And again, because it's the responsibility of every sector, it's often no one's sole responsibility. And so through this technical package, we wanted to really ensure that each sector saw their role in drowning prevention, but also saw how what they're doing is already contributing to protecting lives around water and leveraging that. And so our technical package contains 7 strategies for drowning prevention, and it comes across a very nice acronym of PROTECT. The P corresponds to expanding physical infrastructure that promotes safe interaction with water. So it doesn't just prevent access to water in high-risk environments, but also promotes safe access, because we understand that a number of people rely on the water for everyday tasks, for salary, for transport. The R relates to enhance rescue and resuscitation capability, both for bystanders and communities, but also for professional responders and professional response services, such as lifeguards, such as disaster risk response teams. The O corresponds to strengthening occupational safety for work around water. T towards regulating transport safety standards for travel over water. E is expanding education in basic swimming and water safety. C corresponds to reinforcing childcare systems and safeguarding. And T is improving threat preparedness for floods and other multi-hazard emergencies. Again, I mentioned that the policy space is currently very crowded with a number of competing priorities and competing agendas. And one key thing this technical package tries to do is highlight and speak in the language of co-benefits. And when we talk about drowning prevention, we want to reiterate and ensure that we're not talking about this as a vertical standalone program, but we're also talking about the wide range of other benefits drowning prevention has for different sectors, organisations, and other priority areas. So we share this quite a lot throughout the technical package. We talk about how drowning prevention interventions can improve population health, enhance well-being, strengthen child development, increase lifelong learning opportunities, enhance economic productivity and protection of household livelihoods, promote gender equality, strengthen climate resilience and disaster resilience, reduce flood future emergency response costs, and also support safe mobility, tourism, but also participation. There are so many benefits of investing in drowning prevention. There are also a number of already agreed upon global agendas progress as a result of investing into drowning prevention. The SDGs, the CRC, the Convention of the Rights of the Child, Universal Health Coverage, the International Labour Organization, International Maritime Organization have a number of conventions already adopted by governments that also contribute to drowning prevention. Of course, the Sendai Framework and the UNFCCC too. This is around disaster risk reduction and climate change. So again, drowning prevention is absolutely not a vertical program, and in fact, the benefits spill over into so many different areas. Speaking further to co-benefits of each recommendation, we've taken this a little bit further and shown how every investment in drowning prevention builds safer communities while delivering broader health, social, and economic benefits. So this image is a little bit tricky to see on the screen. So if you allow me to zoom in to show you certain aspects of it, we've taken the 7 protect recommendations and plotted them down the horizontal axis here, sorry, the vertical axis here. And then where you see the intersecting colors, it's how the recommendations actually reinforce and complement each other. So looking here at this first hexagon where the blue meets the green, you can see that if we invest into physical infrastructure and rescue and resuscitation capability, the installation of life-saving stations actually does complement safe water infrastructure. We invest into both rescue and resuscitation capacity and occupational safety. We can see here that workforce rescue protocols strengthen workplace emergency readiness and response. Taking it further, we look at the intersection between education and swimming and water safety and childcare. Water safety education builds awareness among caregivers, children, and vulnerable groups from an early age. Look at the intersection between childcare and threat preparedness. Safeguarding plans in hazard-prone settings strengthen child protection and continuity of care. Again, we really see how all of these different recommendations and interventions reinforce each other and form comprehensive policy benefits. Another key thing this package does is it takes a systems-oriented approach towards strengthening drowning prevention. As I mentioned earlier, the status report showed us that globally, countries are relatively good at implementing interventions. But what we need to do is coordinate complementary interventions across sectors to have the greatest impact possible. And we want to move progress from isolated activities to integrated sustainable systems, which evolve, which progress, which are able to be dynamic and respond to shocks and respond to the dynamic planet we're currently living in, but also that generate wider health, social, economic, and resilience co-benefits. And so we've developed this pathway to progress for the technical package. We're looking at providing examples of where countries might be as they start to move towards generating and developing this strong system for drowning prevention. You can see here at the start, countries may be raising awareness of drowning risks and introducing basic water safety actions through interventions. Building on from this, local drowning prevention programs, services, and response services might be developing. Further, strengthening coordination, safety standards, regulation, and enforcement for drowning prevention might be starting to come into the space. There's much more around policy and legislation. Integration comes next typically. It's embedding drowning prevention across government sectors and wider community systems. And finally, the critical component of sustaining, so maintaining and improving drowning prevention systems over time to support long-term safety around water and community resilience. So again, as I mentioned, we see this progression from isolated activities to coordinated systems to embedded water safety governance. And in fact, we've created one of these protect pathways for each of the 7 protect recommendations. So this is an example from the threat preparedness chapter. The next is an example from the education and basic swimming and water safety chapter. And the final example here is from the transport safety chapter as well. And again, we hope by providing this type of frameworks, countries are able to review these different stepping blocks and perhaps try and place themselves along this continuum and see what the next steps could be to building this stronger, well-functioning, effective drowning prevention system within their country. So this technical package was very recently launched on the 23rd of July this year, and it's available to download using this QR code here. There's a fantastic launch event in Accra in Ghana. And again, it was really well covered by media, fantastic uptake, and we're so pleased to be able to share it this World Drowning Prevention Day. Thank you so much for your time. I hope you enjoyed the presentation, and all the best for the rest of the World Drowning Prevention Day celebrations. Thank you.
Very good. Thank you very much to Caroline for her presentation. Can you hear me? Yes? Yeah. Yes, we can hear you. Now we're going to continue with Dr. C. Bierman, who is the attached Vice President of the Royal Life Saving Society Commonwealth, and he will be talking about preventing drowning in the Caribbean. Steve, you have the floor.
Good day, everyone, and it's very exciting and interesting to see that there are 250 people in the region who are very interested in drowning prevention, interested enough to join this celebratory webinar to mark and acknowledge World Drowning Prevention Day 2026 with its theme, Unite to Turn the Tide. For those who may have joined late, if you click on the bar at the bottom of the screen, you can choose which language you wish to listen to each presentation in. So you'll see English and Spanish as options. And so if that's helpful to you, select the language of your choice. The acceleration of drowning prevention, the Unite to Turn the Tide, all are terminologies that indicate that we are not planning to stand still. We are not planning to continue what we've been doing for the past 30 years at the same pace. We need to actually be innovative. We need to be integrative. We need to strengthen our advocacy. We need to strengthen our data, and we need to align with the global strategy. So as part of the process, I'm trying to advance my slide, but it's not letting me do that here. So just a second. There we go. We met initially as a region in Bogota in October of 2025. And one of the sessions of that very interactive workshop was actually in the water, led by David Spielman from Sabrasa in Brazil. So we not only had discussions about integration, strengthening data, and alignment, we actually participated in doing some of that in water sessions. And so this is the region's first sort of physical workshop associated with the progression of drowning prevention within PAHO and our Americas region. We have a workshop coming up in October of 2026. Sorry, that should say so. Sorry, those were the objectives from 2025. Apologies. This is what we were attempting to do nearly a year ago. Most of the participants in this workshop represented government and government entities from the Caribbean and Latin American, Central American countries.
I'm sorry.
Coming up in 2026, in 2 months from now, we will have a second workshop. This workshop is really focused on civil society and government program delivery entities. So many of the civil society organizations or NGOs in this region need to actually have some assistance and support for developing capacity to deliver some of the things that Carolyn was just talking about. So this workshop is going to be focused on English-speaking countries and territories from the region. That's not to negate or not pay attention to the Spanish and Portuguese countries. And we do need to acknowledge that the International Life-Saving Federation's Americas region, of which there are several representatives of that group on this webinar, have done a really good job in leading, supporting, and developing capacities. And they will continue to do that with a focus on the entire region, but they are particularly strong in the Spanish and Portuguese speaking countries. And so this particular workshop will focus on English-speaking countries and territories. And I've listed the objectives there, but they really invite us to learn more about what's going on, to share the data that we have. And we do have some disaggregated data from this region. So for the Commonwealth countries in this region, we have extensive disaggregated data. And so although the region has a drowning rate that is 1.4-ish and one of the lowest in the world for a region, there are some very prominent issues within the disaggregated data. So Guyana, for example, has a drowning rate of 9.5. The Bahamas, it's above 6. And so we have some interesting data when you disaggregate from our region. We know that the largest percentage of drowning occurs within the region in those from 0 to 5 years of age. And that has a rate amongst the Commonwealth countries of 1.9. And the next highest would be those under the age of 15, which represent more than 50% of the population of those who drown in this region. So we have lots of work to do. We have probably got inaccurate data or not complete data from many of our countries in this region. And there's a unique issue within the region, and that is small island nations and states, which have smaller populations, and so therefore sometimes don't get the attention for public health measures that they deserve and need. And when we disaggregate the data from small island states in the drowning prevention space, we nearly always learn that the majority of drownings occur actually inland and not on that coastal shore of the island. So lots of things to build organizational capacity around, including simple things like governance and program delivery processes, so that the civil society organizations are really investable by their own government, by sponsors, by international public health funding agencies. So the workshop will focus on basic swim skills training, safe rescue training, CPR. There will be a component looking at fishing and water harvesting safety. There will be some discussion and some thinking and work around how do we make our communities more resilient in this climate of extreme weather events.
Steve, I'm sorry. Do you mind turning your camera on, please?
To do that, I need to exit this PowerPoint.
Oh, okay. It's fine
So
then.
I think I'll when the PowerPoint's finished, I could do that. But
Thank you.
so these are the partners. This workshop is co-sponsored by the World Health Organization and the Pan American Health Organization. It is integrated with the Global Alliance that was just discussed by Carolyn. And so there are several partners from the Global Alliance who will be participating in the workshop in Barbados. And there are other supporting organizations who are participating and helping deliver this event to allow us to advance drowning prevention within this region. So the targeted beneficiaries include expanding drowning prevention action, in engaging more programs that are delivered for children, because we know from the data that children have the highest drowning rate in the region. Having communities with more skilled rescuers and more resilience for extreme weather events, and then recognizing that fishers and aquatic harvesting is a traditional practice in this region, and that there's a number of opportunities to make that safer. So in the scheme of things, we had the first workshop in 2025, the second workshop in 2026, upcoming in October in Barbados. The plan would be to have a third workshop, hopefully in 2027, that would actually bring civil society, NGO, and government together. And the focus would really be on how do we collaborate better, how do we coordinate better to deliver more effective drowning prevention action. So that's what we're doing as a region, with great support from the Pan American Health Organization office in Washington, D.C., with in the upcoming workshop with the regional office in Barbados, the country office in Barbados, and with overall support from our WHO office in Geneva. The system doesn't allow me to turn my camera on. I thank you for this opportunity. Thanks to everybody for their great interest in drowning prevention in the region. And we do need to unite as a region. We need to unite as organizations. We need to unite as experts and enthusiastic advocates in this space to turn this tide. Thank you very much.
Oh, I can see you now, Steve. Thank you for your invitation. Muchas gracias, Steve. Ahora vamos a pasar a el video de.
Thank you very much, Steve. Now we're showing our colleagues' video in Brazil. We're about to know more about the experiences of 3 countries. We'll start with Brazil.
Olá, eu sou Letícia Cardoso, diretora do Departamento de Vigilância de Doenças Não Transmissíveis da Secretaria de Vigilância e Saúde e Ambiente do Ministério da Saúde. Estou aqui para celebrar o lançamento do reporte global sobre afogamentos. Esse reporte, ele oportunizou o intercâmbio de informações e de conexões entre vários atores que vinham trabalhando com essa temática no país, atores da sociedade civil, sociedades médicas, setores do próprio governo, com a facilitação da OPAS, e isso oportunizou a gente conhecer ações e intercambiar experiências e oportunidades de intervenção. Além disso, ele trouxe para a gente resultados importantes, trazendo o afogamento para uma discussão dentro da saúde pública, trazendo luz sobre esse problema na saúde pública. O afogamento hoje é a primeira causa de morte entre crianças de 1 a 4 anos no Brasil. Nós podemos verificar que uma parte importante dessa ocorrência de afogamento se deram em rios, açudes, lagos, apesar de nós sermos um país costeiro, né? Temos uma costa, um litoral muito importante no país, nos chamou a atenção a ocorrência desse agravo em rios, açudes e lagos interiorizado no país, né? Então, o que nos faz refletir sobre as nossas medidas de intervenção. Então, foi oportuno porque nós buscamos a intersetorialidade nas nossas ações e podemos, então, dirigir o foco das nossas ações também para o interior do país.
Thank you very much, Dr. Letícia Cardoso from the Ministry of Health in Brazil. Now we're going to our colleagues in Colombia. We pass the floor to Lorena Catalina Alvarez. She's an engineer from the Ministry of Health and Social Protection in Colombia. She'll talk about the process for developing the national plan for preventing drowning. Lorena, you have the floor. Good morning, everybody. Thank you very much and welcome to this webinar. It's very important to have all your participation, and we'd very much like you to show what we're doing in Colombia to prevent drowning.
Listo, me presento, mucho gusto. Soy Lorena Catalina Álvarez
So,
Niño
I'm
del
Lorena
Ministerio de Salud y
Catalina Alvarez
Protección
Niño from
Social,
the Ministry of
y la
Health and
fundación
Social
que está a cargo
Protection, and I'm in
proceso de
charge
agua para uso
of the
recreativo
water process for
Colombia.
recreational process,
Voy a enfocarles
recreational
entonces qué
purposes
estamos
in
haciendo en
Colombia.
Colombia para
So
la
what are we
prevención de
doing in
ahogamientos.
Colombia to prevent
Nosotros tenemos un
drowning?
avance bastante amplio
We
en el tema,
have
pero primero quiero que
progressed
veamos
on
cómo
the
estamos
issue,
aquí en
but
Colombia
first we must
frente al
see
tema de ahogamientos. Acá les voy a
what's
mostrar un
the
poco
Colombian
de las
status
estadísticas
concerning
que tenemos
drowning.
en el momento.
This
Esto
is
es un
the
estudio que
statistics.
hemos
We have this
realizado para un
study
periodo de
we
tiempo desde el
carried
año
out.
2005 hasta el año
It
2025,
goes from
donde
2005 to
vemos que
2025, where we
tenemos
see
departamentos que presentan
some
mayores tasas de
departments
ahogamientos, como es el caso
with
de Antioquia.
larger
Yo quiero contarles
drowning
algo de
rates.
pronto
This is
para
a
los que no
case of
conocen Colombia.
Antioquia. For those
Colombia
who
es un
don't
país
know
muy
Colombia,
rico en
Colombia
aguas
is a
naturales. Nosotros
country
tenemos
that is very
mares,
rich
tenemos
in
grande
natural
cantidad de
waters. We
ríos,
have
tenemos gran cantidad de
sea,
quebradas
we
y
have
muchos lagos,
rivers, we
lagunas.
have
Somos un
ravines,
país muy rico
lakes,
en cuanto a la
lagoons,
presencia
very
hídrica
rich
en
in
nuestras
terms
fuentes, en
of
nuestras regiones,
water
¿sí?
sources in
¿Qué
our
pasa con el
regions.
ahogamiento?
Now, what
Actualmente
happens
tenemos
with
unas tasas
drowning?
bastante
We
altas de
have quite
ahogamientos,
high rates of
presentándose
drowning.
aproximadamente
We have
miles de personas
approximately
por año, pero
1,000
las
deaths per
tasas más
year,
preocupantes se
but the
registran
most concerning
para los rangos
rates
etarios
are
de 5 a
in
9
the
años y
ages
de
of
10 a
5 to 9
14 años,
years and
donde
10
en
to
Colombia
14
el
years.
ahogamiento
In
representa la
Colombia,
primera causa de muerte.
drowning is the first
Viendo
cause of
también
death
otro estudio
in
que hemos
in
realizado
those
frente al género,
age
nos
brackets.
hemos
Now,
dado
concerning
cuenta que
gender, we
los
have
mayores de
realized
casos de
that
ahogamientos se
most
presentan para
drowning
el género
cases are
masculino con un
um,
82.5% y para el
male
femenino de
for males and
17.5%.
only
También hemos
17.5 for
evidenciado que la
females.
mayoría de víctimas está entre la población de 0 a 29
Also,
años con un
most victims are from 0 to
60.5%.
29 years of age.
Igualmente vemos
That's
que tenemos una relación de tasas de
60.5%.
ahogamientos de
And
2.24
there is a
ahogamientos por
rate of
cada 100.000 habitantes.
2.24 drownings per
Por otro
100,000
lado,
inhabitants.
hemos segregado la
We
información
have
frente
also
a en qué lugares es donde
um,
mayormente está ocurriendo el ahogamiento.
gotten
Entonces, como les
information
contaba,
about the
Colombia tiene
places where
muchas
drowning
fuentes hídricas.
occurs. We
Nosotros
have
tenemos
lots
que
of
las
water
mayores tasas de
sources, as I
ahogamiento
said.
se están
Most
presentando
of
en
the
aguas
drowning
naturales con un
rate is in natural
44.8%. Luego
waters,
tenemos unas tasas que no se han
45.8%,
especificado,
then
están como lugar no específico,
unspecified
que puede ser
rates,
porque nunca el momento de la
places, sorry,
detención no
um,
decidieron o no
they
determinaron
didn't
exactamente en dónde
determine
sucedió el ahogamiento.
where the death
Luego tenemos otro
occurred
gran
by
porcentaje
drowning.
en
We also
viviendas
have another
y
large
en piscinas,
drowning
que es
in
como,
pools in
digamos que es la fuente
houses.
hídrica que nosotros como
That's
ministerio
the water
tenemos
source
enfatizado
that
un poco
the
más nuestras
ministry
acciones. Ya les voy a
is
contar en qué vamos.
focusing on. I'll
En
tell
cuanto a
you
las acciones
what we are
concretas que
doing
estamos
about that.
realizando desde el Ministerio de
Concerning
Salud,
concrete
en
actions at the
Colombia
Ministry of
tenemos
Health in Colombia,
una gran
we have
variedad de
a large
normatividades que
variety
vienen
of
desde la Ley 1209
regulations,
de 2008. Estas
starting
normas
from
quiero
Law
enfatizar que son piscinas
1209,
específicamente
dated
para
2008. This is
aguas
for
de uso
pools
recreativo, pero este sí.
specifically for
Entonces, estas
recreational
normas son
use.
para piscinas,
So
normas de seguridad de piscinas,
these
normas de
are
declaración de
safety
conformidad de dispositivos de
regulations for
seguridad. Y
pools.
este
They
año
must
hemos
have
logrado avanzar con
safety
dos resoluciones muy
devices.
importantes,
And
que es
this
la
year we
calidad
have
del
two very
agua
important
de
resolutions,
piscinas con la resolución
water quality
234 de
in pools, and
2016
this is
y la
um,
resolución 929, que están todos los criterios de
0234 dated
construcción y de seguridad de
2026 and
piscinas. Son dos
0929
resoluciones que logramos
dated
expedir este
2026
año.
that has to do with
Tenemos una
pool
tercera resolución
building.
pendiente, que es la
We
de
have a
los
third
dispositivos de seguridad
resolution
de
about
piscinas y
safety
estructuras similares,
devices in
donde
pools and
hablamos de
similar
5
structures, where
dispositivos
we have
que deben tener
5
estos
devices
establecimientos, que
that
son
these
desterramiento,
establishments
las
must
cubiertas
have:
antientrapamiento, el
enclosure,
detector de inyección o alarma de agua, el
anti-trapping
botón de parada
covering,
de emergencia y el sistema de seguridad de
immersion or
liberación de
water
vacíos.
alarm detector,
Esta norma tiene un avance bastante
emergency
importante
stop button,
porque
and vacuum
colaboración con las oficinas del Grupo de
release
Estudios
safety
Sectoriales y
system.
Evaluación de
All this is very
Políticas Públicas del
important
Ministerio de
because we
Salud,
have realized that
elaboramos
the
el análisis
Ministry
de impacto
of
normativo y
Health,
de la
after
implementación de
an
dispositivos de
analysis,
seguridad,
that
donde
implementing
hicimos un
safety
estudio económico
devices
donde pudimos
following
garantizar
an
que el
economic
costo
study
de
could
una
guarantee
vida
that the
es
cost of a life
no, digamos que el costo más bien, digámoslo así, el costo de implementación de estos
The
dispositivos de
cost of
seguridad no
implementing
abarca el costo de
these
una vida.
devices
Estamos diciendo que una vida siempre
is
va a valer
much
más que
lower
implementar
than
el
the
costo de
cost of a
implementar
life.
estos
The cost
dispositivos.
of a
Entonces, este fue
life
un
is
estudio bastante
invaluable.
importante, está en la
So this is a
página del
very
ministerio para quienes
important
lo quieran consultar.
study, and it's
También lo
in
pueden
our
encontrar en Google.
ministry's page
Pero es un estudio muy completo que
website.
hemos
You can also
realizado donde se
find it
avala
in
que la
Google. A
implementación de
very
dispositivos de
complete study
seguridad.
about implementing
Bueno, frente a las dos
safety
resoluciones que les
devices.
comentaba
About the
que
two
salieron este
resolutions I
año, la
commented for
resolución
this year,
234-2026, esta nos
0234
define
in
todos los parámetros
0929.
físicos, químicos y
0234
microbiológicos que
defines
deben
all
tener el
the
agua de piscina,
physical,
se
chemical,
define
and
cuáles son los niveles
microbiological
aceptables y
parameters
cuáles deben
for
ser los
pool
factores tanto
water,
para el control y la
acceptable
vigilancia sanitaria
levels and
del agua de estas
health
piscinas.
control
En la
of
resolución
the water of these
929
pools.
se
As
adoptan
for
todos los criterios
resolution
técnicos de construcción y de seguridad
0929,
y se
this
regulan quiénes
refers
son
to all the
las
technical
autoridades que van a tener
criteria
vigilancia.
for safety, and there is the
Piscinas.
regulation of authorities that
Hay un
will
proceso muy
surveil
importante que estamos
pools.
manejando en esta
There's a very
resolución, en la
important
resolución
process in
234, y
Resolution
es un tema de
234,
autorregulación de
which is
cadenas de
self-regulation
aseguramiento de cadenas
of
productivas. Entonces, estamos
productive
hablando del
chain
macroproceso de
assurance. We're
aseguramiento
talking
sanitario
about
de cadena
a
productiva
macro
asociada
process
de
of
agua para uso recreacional.
health
¿A qué vamos con
chain
esto? Con esto estamos diciendo que la responsabilidad
assurance. What are
para
we
la
saying with
prevención de
this? That the
ahogamiento, para la
responsibility
seguridad
for
de una piscina
preventing
no depende simplemente de la entidad
drowning
responsable,
or the
sino
safety
que
in a pool
cada
does
uno
not
de los
depend
actores que
only
involucran
on responsible
este
entities,
tema,
but on
desde el
each
responsable de
one of
piscina,
the
desde los constructores y
players,
operarios,
those
los
responsible for the
proveedores, los
tune
bañistas y los
builders,
usuarios,
operators,
las entidades de formación y
bathers,
todas las
users,
autoridades que hacemos las vigilancias a estos
teaching
establecimientos.
entities,
Todos
and
somos
all those who
actores clave
surveil
que
these
tenemos que
establishments. All
cumplir
of
con
us
una
are
función de
key players,
autorregulación
and each
en
one
donde
has a self-regulating
estamos diciendo que
function.
cada una de estas personas
Each one
tiene
of
una
these
capacidad para regularse
persons
y
has
ajustarse
the
por sí
capacity
mismo
to
para cumplir
self-regulate
con
and
toda la normatividad
self-adjust
que está
to
también en
abide
el
by all
establecimiento en el
the
momento para pues
regulations
hacer unas buenas
that
prácticas
are
sanitarias.
current now towards
Igualmente,
good health
tenemos
practices.
unas normas de seguridad que vienen
We
desde
also
la ley
have
009, donde nos dicen
safety
a nosotros que las
regulations
piscinas tienen que
in
cumplir con ciertos requisitos,
0929.
como es, por ejemplo, el
They
acceso
have
restringido a
pools have
menores
to
de edad,
have
el agua
restricted
limpia y
access
sana
to
permanentemente, contar
minors.
con
The
botiquines de
water
primeros
has to be
auxilios, contar con dos
clean and
flotadores y
healthy
un
at all
bastón con
times.
gancho,
There
tienen
should
que
be a
tener
first
señalizadas las
aid
profundidades de las
box,
piscinas, tiene que haber un
two
teléfono de emergencia disponible 24 horas y tienen
cords
que contar
with
con los dispositivos de seguridad
safeguarding
homologados,
floats,
además del
and
cumplimiento
also
normativo de
signaling,
las resoluciones
emergency
929 y de la
phone
ley 1209
available
de 2008.
24/7, and
Bueno,
also
esto en cuanto a las normatividades que
standardized
hemos emitido desde el Ministerio
safety
de Salud.
devices.
Ahora hay un tema
This
muy
is what
importante que
our
estamos también
ministry
liderando,
issued. There's another
que es el Plan
important
Nacional de Seguridad
um,
Acuática. Si bien es
program we
cierto,
have, which is the
estamos hablando
National
frente a prevención de ahogamiento.
Water
Acá
Safety
hemos
Plan
decidido no
to
nombrar el
prevent
plan como un Plan
drowning.
Nacional de Prevención de Ahogamientos,
This is not
porque
called
todos sabemos los que
drowning
trabajamos en el
prevention
tema, sabemos que el
because
ahogamiento es un
all
evento
of us
totalmente
know that
prevenible. Y como evento
drowning is
prevenible,
totally
estamos hablando
preventable,
de
and
que
as
esperamos que
a
las cifras de
preventable
ahogamiento lleguen a cero.
uh,
¿Qué va a pasar cuando las cifras lleguen a
action,
cero?
we
Nosotros estamos
want
hablando de seguridad
those
acuática,
figures to
que es
reach
la
zero,
implementación de todas
but
estas
we also
normatividades.
have
Yo acá les
water
muestro frente a
safety
piscinas, pero
at
también tenemos
large.
normatividades en mares, tenemos
We have
normatividades en ríos y en
regulations for
lagos, ¿sí?
pools, for
Y estamos
sea,
realizando un trabajo
for rivers,
multisectorial para
and
hacer
lakes.
una seguridad no
And we are
solamente de prevención de ahogamiento,
working
sino que haya una educación,
intersectorally
tiene
to
que haber una
prevent
transversabilidad en
drowning
las acciones que se están
and
realizando.
to have
Entonces, quiero contarles en
cross-cutting
breve en qué vamos,
actions.
porque
I'd
este plan
like
que
you
hasta
to
ahora está en
briefly tell
construcción,
you what we
¿listo?
are
Tenemos
doing.
unas
This
pequeñas
is a
fases hasta
plan
ahora,
that we are still
en las
building.
cuales
There are a
hemos
number
realizado
of
un mapeo de
stages in our
actores.
plan.
Este
First of
mapeo
all,
se realizó mediante una
actor
metodología que se
mapping. This
llama
was done
ofWorld, que
through
es
a
un One Plug,
methodology.
One Product,
It's
que
one
básicamente es un
slash one
PowerPoint.
product,
Es
one
trabajar
one
todos los
people, one
actores que estamos
product.
definiendo que tenemos acciones frente al
And
tema,
it
trabajar
means that
juntos
all
por la prevención de
players have
ahogamiento,
to
seguridad
carry out
acuática.
actions
Entonces,
around water
para
safety.
este mapeo,
For this
hemos escogido
mapping,
yo
we chose criteria to include players into our plan. These two criteria were water safety role and regulatory competence. So the Ministry of Health and Social Protection has a water safety role in pool regulations and similar structures, and our normative or regulatory competence is that we are the regulatory entity and the technical leader. The Ministry of Environment and Sustainable Development has to define guidelines for the sustainable use of rivers, lakes, water areas in coastal zones, bogs also, and they're the regulatory entity. The Ministry of Tourism Industry and Trade coordinates actions for the safety of tourists and tourist destinations. Again, a regulatory entity. The Sports Ministry, again, a regulatory entity in all sports facilities. The Ministry of Education, they are important because that everything we work here has to be formulated into education programs from the early childhood, like, for example, learning how to swim. And this is also, this ministry is also a regulatory entity. DANE is in charge of consolidating statistics on death due to drowning. And it's an information system, and they do statistic reports. Also, the General Maritime Directorate, DIMAR, concerning specific regulations in seas and beaches, a regulatory entity, and the National Unit for Managing Risks and Disasters, also the National Navy. They are sovereign in controlling and security in maritime and riverine spaces. They are in charge of maritime and riverine safety. SENA, they are in charge of training, safeguarding operators, and drowning prevention, and the National Medicine Institute in charge of statistics and epidemiology analysis by regions and deaths. And these players that have to do with response, rescue, and saving, like autonomous regional entities, Red Cross, and firefighters. We have a first workshop with all these players, and we determined a number of actions for this plan. Wanted to tell you also how our sectoral dynamic works here in Colombia. We have the Caribbean and island region, where we have beach tourism and nautics sports, the Amazon region, where there's mostly riverine transportation and fishing, the Orinoquia, where we have recreational rivers and fishing. In the Andean region, we have pools, sports scenarios, and sports tourism. In the Pacific area, where we have coastal communities, sailing, and fishing. We have fishing almost all over, and we also associate drowning to work in water scenarios. What happens with all these players? We need to identify their capacities in the departments and municipalities concerning life saving and rescuing, and we have to identify all successful experiences and take them to our plan. This national plan must be an action plan we will take to territories for their implementation.
El Plan Mundial de Prevención de Ahogamientos
These
Tenemos lo que es
pillars
el
have
eje
been
1, que
aligned
es la
with the World
gobernanza, el
Plan. We
liderazgo y la
have
articulación
Pillar
intersectorial.
1,
Un
governance,
segundo
leadership, and
eje
intersector
frente a la gestión del
articulation.
conocimiento,
A
la
second
vigilancia
one
y la
regarding
investigación.
knowledge
Un
management,
tercer eje
surveillance,
frente a los
and
entornos
research.
acuáticos seguros y la gestión del riesgo.
Another
Un
on
cuarto
safe
eje que va
water
alineado hacia la
environments
educación,
and risk
seguridad del agua y
management.
desarrollo de
A fourth one that
capacidades.
goes toward
Y un quinto
education,
eje
water
que es
culture, and
centrado
development
hacia
of
la
capacities. And a
prevención, la
fifth,
respuesta y la resiliencia
prevention,
comunitaria.
response, and community
Voy a presentar
resilience.
rápidamente el árbol de problemas
I
que
will
hemos
quickly
generado.
present
Como les digo, este
the
plan está en
problem tree that
construcción,
we've
así que hasta el
generated. As
momento
I
hemos
said, this is a
avanzado
work
en
in
ciertos
progress.
temas, como poder definir cuál va a
So we
ser el
have
problema central
advanced
que
on
estamos
certain
manejando en
problems,
este
such as
plan,
defining
y
the
esto
main
va
issue,
alineado a las altas tasas de
and this
mortalidad
goes
y
aligned with
morbilidad
high
asociados a los eventos
rates of
de ahogamiento en Colombia.
morbidity and
¿Cuáles son las
mortality
causas de este
related to
problema?
drowning in
Entonces hemos
Colombia. What are the
identificado,
causes
por
of this
ejemplo,
issue?
la
So
baja
we've
cultura
identified
en la
low
prevención y la
culture
seguridad
in
acuática,
prevention and
que
water
va
safety
como alineado a una escasa educación en
that
seguridad
goes
acuática,
in line
desconocimiento de
with
factores de
scarce
riesgos,
water
una
security
baja
education,
capacitación o
lack of knowledge
ineficiencia
on
de
risk
campañas de
factors, low
concientización.
training
Tenemos una
in
segunda causa
swimming,
alineada hacia la
or
ausencia o debilidad en
low
acciones de mitigación de los factores
conscience.
de riesgo, como son la señalización, la cobertura del personal de
Then we
salvamento,
have absence or weakness
infraestructura
in mitigation
deficientes
action or
o la
mitigating
falta de
risk
los
factors,
dispositivos de seguridad.
such
La
as a
siguiente
lack of
causa está alineada hacia la ausencia de
safety
instrumentos
devices.
de política
Another is
relacionados.
related
Ya
to an
hablamos ya
absence of
de
policy
normativa
instruments,
específica para temas
such
de
as
mares, de
specific
ríos, de
norms
lagos,
for
¿sí? La falta de protocolos
that rule
simplificados
over
y sobre todo
lakes,
la
rivers,
intersectorialidad.
the
Sabemos
sea,
que este
a
plan
lack of
de
specific
ahogamiento
norms, and a
no
lack of
solamente le compete a SADER,
intersectoriality.
sino que es un
We
plan que
know
tiene
that
que
this
ir
is a
alineado con los
plan
demás
that is not
sectores para
only
trabajar en la
under
misma
health,
causa.
but other sectors to
Otra
work
causa
for the
identificada es
same
la
cause.
limitada capacidad de
Another cause
respuesta,
identified is
dificultad de
limited response
escape, los
capacity.
equipamientos de los equipos especializados, la
Specialized
articulación
equipment is
intersectorial y
limited,
hablamos también de
intersector
los comités
articulation,
territoriales
and
especializados en riesgo.
also
Por último, estamos teniendo en cuenta
special territory
unas
committees
causas que
which
son
are
las
at risk. And
condiciones
finally,
climáticas
we
extremas.
have
¿Sí? Otro plan
extreme
principal que
weather
queremos
events.
hacerle un poquito de
Another part of
énfasis
this
son
plan
todos estos
that we would
ahogamientos que
like to
ocurren
emphasize on are
a
these
causa
drownings occurring as a
de eventos
cause
climáticos extremos que
of
pueden ser
extreme weather
desastres
events
súbitos,
that
que
may
pueden ser
be
inundaciones, ¿sí? O cualquier otro
sudden
evento extremo
floods,
que
flash
termine en el
flooding, or any
ahogamiento de
other
alguna
extreme
persona.
event which leads to
Bueno, tenemos
someone
unos
drowning.
retos a
So
seguir.
we have some
Los
challenges to
retos primero pues
follow,
es continuar actualizando estos antecedentes y esquemas
continue to update
conceptual.
the
Si se dan
history
cuenta,
and the
presidente, en este momento
conceptual
está muy alineado
framework.
en salud, pero como les digo,
Currently,
este
it is
plan
much aligned with
tiene que ser
health,
intersectorial, es decir, que
but
aquí
the
tenemos que
plan must
tener
be
ambiente,
intersectorial,
tenemos que
so we
tener
need
la
to have
turismo, tenemos que
environment,
tener
tourism,
la infraestructura, ¿sí? También hemos
infrastructure.
definido las metodologías
We've also
alineadas
defined
con el DNP, que es
methodologies in
la
line
Dirección
with the
Nacional de
DNP,
Planeación,
the
para
National
poder
Planning
armonizar frente a la
Office,
normatividad
to
nacional.
harmonize with
Pasos
national
siguientes de este
norms.
plan, la formulación del plan de
Next steps
acción,
for the plan is
definiendo los
formulating an
tiempos y
action
los
plan,
responsables de cada
deciding
una de las
times
actividades que se generen.
and leads for each of the
Como les dije,
activities generated.
estos
As
cinco
I've
ejes se van
shown,
a
these 5
desarrollar
pillars
en unas
will
líneas estratégicas. De
develop
estas
in
líneas
strategic
estratégicas
lines,
tienen que salir unas
which in
actividades con un
turn
cumplimiento a corto,
must have
mediano y largo
activities
plazo.
with
Y por último, pues
fulfillment in the short,
vamos a
medium, and
terminar de
long
elaborar
term.
si
And
este
lastly, we
instrumento
must
vamos
finish
a
working on
emitirlo
whether
por medio
this
de una
instrument, we
normatividad
will
para su
issue it
aplicación,
via
¿sí?
a norm
Estos
for its
temas todavía no han sido
application.
definidos.
These
Y por
issues have
último,
not yet
la
been
gestión de los
defined.
recursos
And
para la
lastly, resource
implementación de
management
este
for
Plan Nacional
implementing
de Seguridad Acuática.
this national plan.
Con esto les doy las gracias por el
I'd like to
espacio
thank you
acá
for the
y
space,
nada, continuamos aquí trabajando por la
and
prevención
we'll
de
carry
ahogamiento.
on working
Gracias.
in drowning prevention. Thank
Perfecto,
you.
muchas gracias Lorena por compartir la
And thank you so
experiencia
much,
en
Lorena,
Colombia
for
en el desarrollo
sharing the
del Plan
experience in
Nacional de
Colombia,
Seguridad
development
Acuática
of the
como
National
básico
Water
para
Safety Plan, which
para la
poses a
prevención de
fundamental step
ahogamientos.
for preventing
Su exposición
drowning.
también nos dejó
Their
claro
presentation also
el
leaves
gran
us
equipo y
clear
el trabajo
on the
multisectorial
importance of
intersectorial para la
multisectorial
prevención de
efforts
ahogamientos. Así
to
que
prevent
esperamos
drowning.
que esto
So we hope
haya inspirado a
this
los
has
países de la
inspired
región
other
para
countries
que
in our
realicen sus
region
planes, los países que no
to
tengan.
make their
Y pues estaremos en
plans,
espera
and
por
we'll
buenas
be
noticias del
expecting good
país cuando tengan
news
ya la aprobación
from the
del plan.
country once the plan
Ahora sigue el
is was passed. Moving along with the agenda, we're going to move to Ecuador with Ruben Males, specialist from the National Office of Health Services, who will be presenting the experience of developing the first water rescue workshop. Good afternoon, Ruben. Come in.
Encender tu cámara sería fenomenal. Muchas gracias.
Le encendí, no sé si me pueden ver.
If you can turn on your camera, it's great. I turned on my camera. Yes, I can see you. All right. You can see my presentation.
La forma del presentador. Si puedes.
Muy amable, muchas gracias. Un saludo cordial desde el Ministerio de Salud Pública aquí del Ecuador.
Warm regards from the Ministry of Public Health, Ecuador. Regards from our director, also Dr. Torres.
Perdóname, Rubén, por interrumpirte. Estamos viendo la
Sorry for
presentación,
interrupting. We're seeing the presentation with your notes, not in presentation mode.
Ahí pueden verla.
Sí, podemos ver, seguimos viendo las notas, pero se puede visualizar la presentación.
And we
Adelante.
can continue seeing the notes, though we can see the presentation, so you can go ahead. Apologies for the notes on our end, the Ministry of Public Health. What we attempted to try to do at our office is to have clear that we are fulfilling many duties, activities as primary and secondary transport, mobile general units, as well as hospitals. Obviously, currently we have more eastern parts with water units that are truly providing service nationwide. And with regards to the matter, the national direction, what it decided at this point was to train the staff at the national level with a national call to 1,200 healthcare workers, among them external entities, to become part of the training. And then we also had a part which is selection of staff. Under staff selection, they needed to fulfill certain parameters in health, knowledge of health, basic swimming, which would later be assessed by the instructing staff. We also had to select the staff of instructors comprised by the armed forces, the national police, the fire brigade, and privates. After that, a classification was made on basic training, which contemplates 5 days for beginning ongoing training that will come later during this year and the next. The goal was to train in basics to respond to emergencies which require rescue actions in open water and other environments. The goal of the training was tending to victims in ship wreckages
o personas desaparecidas también para hacer aquello. O lo que más hemos visto en
or
algunas
supporting
provincias,
staff. What we have seen in some provinces are vehicles trapped in rivers, as well as people being rescued in flooding events. We've had cases with the Enzo phenomenon, with the tide rising, streets being flooded. And so what we've done this time is to evacuate patients from a health center to a nearby location.
Esta actividad que contempló netamente fue la
This
guía.
activity
Ustedes pueden ver las
considered
imágenes. Entre estas
a
imágenes,
training guide.
ve el inicio del entrenamiento.
Here we
¿En qué
see
constó este inicio del entrenamiento?
the start of
Primeramente,
training,
ver que el personal tenga la capacidad técnica para
which
poder
ensures
nadar,
that staff has the
qué
technical
técnicas
capacity to
conocían, dónde se podían
swim,
desplazar,
how to
se les
move.
enseñó las técnicas de nado,
They were
entrenarles
taught
3
swimming
iniciales
techniques,
con la finalidad de
3 to
poder
begin,
desplazarse y luego el conocimiento de los equipos básicos
and
con los que
then
iban a trabajar dentro de la
basic
formación.
equipment training
Esto fue en los primeros 2 días. Esto
for
contempló
2
una
days,
formación total de un nado
which
de
included total
25,
training
50, 100 y hasta 300 metros.
of
Si el personal no alcanzaba esta formación, lo que hacíamos es
training
una
for
hora más de
swimming
entrenamiento,
at 25, 50, 100, and
generando
300
nuevas
meters.
habilidades en el nado entre 50 y 100 metros durante el día
New
y
skills,
así
new
más
swimming
el
skills
conocimiento
were
de las
generated.
técnicas y de los equipos. Esto prácticamente fue una hora total que se lo hacía
This was
durante
for a
las
full
prácticas.
hour during
También
practice.
tuvimos las clases teóricas donde
We also
nosotros
had
hicimos
theory classes.
la formación o en este caso la retroalimentación también de algunos
Where we did the
conocimientos,
training, and in this case
netamente
of the feedback of
de la
some
activación
knowledge,
del
strictly
CISECO
of the
911,
activation of CSECO
tomando en
911,
cuenta que el personal debe tener
considering
conocimiento en
that the
aspectos
staff must
básicos en
have
materias
knowledge
de
in basic
cardio, manejo
physiology,
de
cardio
trauma y
management,
la
trauma
clasificación de los
management,
pacientes en el
and
triage.
classification of
Así también
patients in
tuvimos
triage.
talleres en tornos para
We also
rescate o la
had
recepción
workshops
del
for
paciente también, que
rescue,
es muy importante al finalizar de un
receiving a
rescate,
patient, which is
la
very important upon
implementación
finishing rescue,
técnica o
technical
manejar conocimientos
implementation, or
en
knowledge
atención.
management in
Y por
attention.
finalizado tenemos
And
médicos
lastly, we have
post-emergente, ya que muchos de
post-emergency
los técnicos
psychological
que
management,
participaron
since many
eran
of the
personas que
technicians
eran tanto del
participating
oriente y la
were
costa
people from the
y
west and the
sabían
coast,
manifestar que después de un
and they
rescate o
stated that
posterior a una
after a
actividad,
rescue or an
el tener
activity,
la vivencia de
having
rescatar a una
the
persona que
experience of
posiblemente había
rescuing a
fallecido porque no
person
se
that
atendieron a
possibly has
tiempo
died
era
because
muy
they were not
fuerte.
tended to
Entonces
at time was very
vimos la
strong. So
necesidad
we saw the
de dar ese
need
taller
to
psicológico
provide this
que
psychological
obviamente
workshop,
permitió la
which
apertura
obviously allowed
de los técnicos, pero
the
también nos
openness of
permitió a
technicians,
nosotros
but it also allowed
identificar
us
con claridad
to identify
la
clearly
necesidad de cada uno
the
de ellos y
need
cómo llegar a ellos.
from each of them and how to get
Pudimos
to them.
evidenciar
We
que
were
las
able to
acciones o
see that
actividades
the
que hacía tanto
actions or
Policía
activities
Nacional o el
that both the
personal de
National Police
Fuerza de Bomberos
or
de Bomberos,
the Armed Forces or Fire
la
Brigade was doing,
resiliencia en
the
estas acciones
resilience
donde
in
no
these
fueron. Por lo
actions was
tanto,
very strong.
se hizo
Therefore,
acciones de catarsis y también iniciamos
catharsis
acciones
actions
de
were made, and we also
prevención y
made
seguimiento.
actions of prevention and
Nos
follow-up.
reunimos con la empresa
We
privada que
joined
obviamente se les
private
dio seguimiento a
companies,
estas
and
personas
obviously
para que
these people
puedan
were tracked so
continuar con sus
that they could
actividades de
carry on with their
rescate
activities in
en sus
rescue
instituciones.
in their institutions.
Estos logros en las técnicas de
These
rescate nos
These
ayudó
achievements on rescue
realmente a hacer en
techniques
aguas abiertas, en profundidad,
helped us to work
usar
in
todos los
open
equipos,
waters,
hacer
in
cómo llegar a un
deep
paciente
areas,
y
using
rescatarlo,
all the
si es
equipment,
que el personal de
knowing how to
intervención,
reach
cuánto de
a
profundidad podría
person,
haber y esta
rescue
resistencia
him or
requería
her.
la ayuda
Um,
de los
uh,
técnicos que estaban en campo de
the
apoyo después
the
del mal Servicio
resistance
Nacional
they
fue
still
muy
had,
clave para fortalecer no solo el
it was
conocimiento,
very
sino
important
que también
to
nos permitió
teach all these
identificar
professionals, not only
personas
to
que
strengthen
en
their
un posible
knowledge, but
futuro
we
y en el
also
corto plazo
identified
pueden
people
convertirse en
that
instructores directos del Ministerio de Salud Pública para
in
estos
just a
temas en los
little
que
time
se
can
está
become
trabajando.
instructors themselves for the
No sé si se
Ministry of
puede
Public Health.
contemplar parte del video.
I don't know if you can see part of the video here.
Usted,
Yes, yes, we can
usted
see it.
podrá ver el
You can
acercamiento.
see
Esto era
here
parte del entrenamiento.
the
Lo que
approach.
hacíamos es
This
que
is
ellos
part of the
puedan llegar
training.
hacia la víctima
They
y
must be
cuando
able
llegaban a
to
la víctima,
reach the
el
victim,
entrenador, como
and when they
en este
reach the
caso,
victim, the
sometía al
instructor
participante a un estrés.
submitted the
Y son
participant to
realidades que están
stress.
pasando
These are
en el
realities
momento
that
en
can
donde
happen when
lo que se
there's
hacía es que es
a
implementar
drowning.
técnicas, cómo
We
acercarse,
implemented
cómo
techniques
apoyarse
for
con
the
las personas que
approach,
pueden estar en embarcación
getting
y
support from
obviamente la
people who
evacuación del
could
mismo
be
hacia un punto más
on
seguro.
a vessel
Así
and
también
evacuate the
tuvimos la
person
otra
towards a
práctica
safer place. Also, the
donde
other
lo que
practice
podíamos ver
here
es
where we
cómo se
can
debe
see
llegar hacia un
how
punto en
you
una
must
embarcación, lo que usted vio al
reach
inicio
a
con los
point where
saltos,
there's
les
a
enseñaban
vessel.
cómo saltar.
Here, they jump
Esta
from the
práctica duró
vessel.
alrededor
They
hasta las
teach
12 de la
them
noche porque tenían que aprender muy bien los
how to
participantes
jump from it.
cómo llegar a la víctima, cómo
It was
abordarlo,
even
cómo
taught at
identificarlo.
night because
Un
you
poco más
can
adelante les voy a decir
sometimes need
cuáles
to
son la
reach
parte más
victims
básica
and
que
identify
hicimos para que
victims by
el
night.
participante pueda entender
These are
lo que iba
basic
a hacer durante estas acciones.
areas they need to cover so they
Lo que
can
usted puede ver es
understand what to do
allí es
during all
cómo
these
se
actions,
acercan, cómo lo
how
abordan,
they
cómo
approach, how
logran subir
they
inmediatamente en la
will
embarcación.
um,
Obviamente esto era en un lugar ya controlado. Luego
board
podemos ver en un
the
entorno más
person
abierto
on the
y cómo
vessel.
el personal tenía
And
que
we can
lograr
see this in
subir en
open waters
embarcación
too.
con apoyo y sin
The
apoyo.
staff has
¿Sí?
to be able to come
¿Qué es lo que se
aboard
logró entre
the
estas
vessel
técnicas
without any
en
support
aguas?
too. What
personal a aguas
the
abiertas.
what were we
Se
able
escogió
to
un
do
lugar en la
afterwards?
provincia de
We took
Imbabura,
our staff
en el
to
lago,
open
donde la
waters, a lake in the
temperatura llegaba a
Imbabura
ser
province. The
menos
temperature
de 10
there
grados,
is
nuestras
less
ciudades
than
eran
10
un poco
degrees,
fuerte.
sometimes 5
En las
degrees,
horas de la
uh,
mañana, obviamente, en el
very
transcurso del día iba
cold.
cambiando la temperatura,
That was in
pero
morning hours.
lo
During the
que
day, the
hicimos es que el
temperature
personal
changes, but
logre un
the
nado en una
the
profundidad de
staff
300 metros. Lo que hacíamos
swam
es una
for
prueba física
300
para que el
meters. This
personal
was a
sea
physical
consciente
test
de que no
for
solo
our
es un
staff
entorno
to realize that
controlado,
it's
sino
not
un
only
lugar más
in a
abierto.
controlled
Pero las
area, but
técnicas de
also in a
salto,
more
movimiento,
open
lo que
area.
aquí son los
Also,
participantes.
jumping and movement
Hacíamos grupo
techniques.
alrededor de 12
We made
participaban
groups
saltar desde
of
lanchas y luego
12
las técnicas de
people that
rescate
jumped
ya
from
en
the
la lancha, ya haciendo todas las técnicas como
boats,
tienen que hacer.
and then
Y por último era la
all
atención al
practicing
paciente
all the
aplicando todos
rescue
los
techniques,
conocimientos. Algo que
applying that
podíamos
to
identificar y que es normal dentro de
victims,
un entrenamiento
applying
cuando
all
es
our
bajo
knowledge.
presión, es que
And
los
this is
conocimientos
training
a
under
prueba
pressure also.
prácticamente pueden variar. Los puntos de
Knowledge
vista empírico
can
pueden ser
vary
unos y los
when
del otro.
tested.
La
Points of view can be
visualización, o en este
different.
caso,
Um,
el poder decir qué
how
tipo de
much you can see,
patología
for
tiene el
example, or
paciente
the
o qué
kind
diagnóstico podría
of
ser,
pathology
variaba. Por lo tanto,
the
investigábamos y
patient
reforzábamos
can have.
constantemente dentro
So
de la
we
capacitación.
varied their training
Entonces
all
es
the
así
time,
como usted puede ver
reinforcing different
que
aspects
el
all the
personal
time. This is
tenía que
how
hacer
you
las
see
prácticas ya
that the
dentro
staff had to
de la laguna, saltar. Esto que
practice
está viendo aquí es parte del
in the
entrenamiento,
lake,
es donde
jumping
les
first.
dejábamos
This
300
part of the
metros de
training.
distancia, lo
We
que se había mencionado,
left,
para que puedan
we
nadar.
had them swim
Algo
for
que nos
300
llamó mucho la
meters,
atención, las
and
personas
they
que
need
tenían
to
un
reach
curso para
that
nadar
point.
o que en ese
Uh,
momento del inicio de la
we
selectividad creían que podían
realized
nadar,
that, well,
no
when we
preveía
were
el aceptar
selecting
o perder curso,
our
pero les
personnel,
ayudó a tomar una
people
decisión.
said
Esta
they
decisión
knew
fue
how to
formarse,
swim, but
fue
they didn't
aceptar la
realize
situación
this
y
course
terminar
was
el
so
curso
demanding.
entre los
They
mejores.
accepted the
En un lugar más
situation
controlado,
and ended up by being the best
lo que
ones.
hicimos es que el personal
In
puede
a more
identificar
controlled
al paciente
area,
aplicando una analogía
we
que le llamamos PAHO, que
identified
vamos a verlo un poquito más
the
adelante, donde el
patient
personal
with
evidencia el
PATO technique,
entorno, el
PATO in
técnico
Spanish. First
describe
of
qué
all,
equipo va a usar, obviamente con
the
medidas de seguridad y con quién se va a apoyar.
rescuer decides
Lo que usted
the
ve aquí es el acercamiento
equipment to
prácticamente hacia una
use.
víctima.
He
Aquí ya vieron una
who
piscina,
he
pero en un
would
lugar un poco más controlado.
go to the
Y
rescue
por
with.
último,
This is a more
de la
controlled
misma
area,
técnica
not
y de la
as
misma
controlled
práctica,
as a pool,
teníamos ya los
but
acercamientos un
we
poco
also
más
had
abierto. Estamos
more
hablando de
open
unas
approaches
distancias de
here
arriba de 200
on the other side.
metros
These are
del muelle que se estaba
200
practicando.
meters
Y con
from
nosotros siempre
the
aplicando las técnicas que ya habíamos hablado.
dock,
Aquí, en
always
cambio, lo que
applying the same
podíamos es
techniques we had
fortalecer
taught them.
el
Here we
pensamiento
see that we need
psicológico de
to
las personas
strengthen
porque ya estaba pasando
their
la temperatura,
thinking
el
and
estrés
their
era alto,
psychology.
tratábamos de
It
cuidar
was
también
a
a
high
personas durante la
stress and
práctica,
low
pero
temperature.
éramos conscientes que el
We
personal
wanted to
tenía que
take care
alcanzar
of
el
them, but
nivel que
we
nos
were
dejamos
aware
propuesto en
that
esta
they had
ocasión
to
con la
reach
finalidad
the
de poder
level
dar
we
respuesta a
wanted them
todo lo
to
que se estaba
attain
hablando en
so
este
they
momento,
could
de no solo el rescate,
respond
sino
to
atender un
cases
entorno
as
a una
these,
víctima que se
not
estaba dando.
only rescue, but also how
Como
to
les había mencionado,
uh,
en el cuarto y quinto día de la
take
formación,
care
lo
of
que
a
nosotros
victim
habíamos hecho
afterwards.
es
This is
que el
the
personal tenga
PATO
una percepción del
technique or
problema, tenga la aptitud
list,
visual de
let's say.
identificar a la
They
víctima,
need to have a perception of
tiene
a
que ver la
problem. They
valoración
need
del
to
entorno,
analyze the
obviamente de la
situation.
víctima, la
They need to
percepción del
take a
movimiento, que es un
decision
dato muy
and
importante en un
organize their
ahogamiento, qué es lo
rescue.
que deben hacer,
They
un
need
análisis
to have
situacional que
broad
contraste todo lo evento, si es que es seguro o no es
visual
seguro para ellos,
perception,
el acercamiento en una toma de decisión. Ellos son los que
analyze
deciden
and
en una acción
check the
dirigida, como
entire
acción inicial.
event
Tomamos muy en cuenta de que,
approach.
que cualquier entorno
They
no es que yo
select an
ingrese,
action
sino
to
que
take,
yo decido, yo
and
analizo mi área de seguridad y obviamente me apoyo con otras
they
entidades en la
provide
posibilidad para dar una
initial
respuesta.
care.
Y también la
This
organización
is
les
all
ayuda.
that has to do with
Posterior a esto,
decision
el personal,
making.
después de hacer el
And
rescate,
then they
lo ingresa
organize
a la embarcación y da los
the
primeros auxilios
saving
dentro de la
part of a
embarcación
person
con el
after
material y
the
equipo que les
rescue
he
with
entregado que
first
tiene cada una
aid,
de ellas o situacional
material,
prehospitalario. Después
equipment,
así
well, they provide pre-hospital care, and they always have all the materials needed at every unit. So this is continuous training for all of our personnel. And we check the time they take to rescue the person. That's very important. Something we identified. At the beginning, we had a delay of like 10 minutes too long. Then that was taken down to 8 and then to 5. And the last rescue we did in a practice, we were able to rescue the person in 3 minutes, synchronized swimming, continuous training, and application of techniques were very important. What did we achieve? Our staff ended by responding appropriately. They know how to approach a victim, how to decide on rescuing the victim, how to approach the victim, apply their techniques, and evacuating the patient to a safer place. I lost his sound. Okay. In our training, we also took a look at our mistakes. Errors were very important. We needed to know what happened to our personnel during evacuation. Like, for example, areas that were not appropriate, surroundings that did not allow movement. Their technical capacity should be not only for swimming, but also for transporting. We talked about coordination with other institutions, very important. Interinstitutional coordination in the country has allowed us to deploy support from other institutions, armed forces, police, firefighters, which has allowed us to do rescue as it should. At the end of all this training, our staff was certified. It's an achievement. It's the first time that the Ministry of Health does this with a view of continuous training. This is basic training. We chose 50 people from this basic training. Then they go to intermediate and more advanced trainings. This course took 5 days. The next one will take 15 days. And finally, there will be a 1-month intensive course guided by international and domestic instructors with the support of the armed forces and national police. The ministry is very committed not only on training our staff, but also on working on pre-hospital care and strengthening other institutions. 15 days ago, the Social Security took account our guidelines for training, and they launched their own course in the Guayas province. They trained 30 people, and it was a success. So it's being replicated. We're having good response, and obviously the benefit is being able to save more lives. I hope you like my presentation, and you can see that we are making great strides in training our people with success. Thank you very much, Ruben, for sharing the Ecuadorian experience. Very valuable to know this comprehensive training program for response personnel, combining theory, water rescue, attending to emergencies, and even psychological support after trauma. Thank you very much to you and Dr. Ortega for telling us about your experience. Unfortunately, we can't open a space for questions because of time, but we have a recording in English and Spanish, It'll be posted on our website, and there you can access to the information we gave today at this webinar. Before closing, I'd like to pass the floor to Ricardo. Thank you very much. Alessandra Ceniza was with you.
Me sumo a este agradecimiento a todas
Yeah,
y
I
todos los
also
colegas que
joined to
amablemente
these
participaron en esta
thanks
reunión
to
virtual,
all the colleagues who kindly
compartiendo sus reflexiones y
participated in
producto de su
at this
trabajo.
virtual
Steve
meeting,
y Lorena,
sharing
de verdad,
their
muchísimas
reflections
gracias.
and the fruit
Muchas
of
gracias
their
a
work.
Alessandra,
Steve,
Stephanie,
Lorena,
Aranza, del equipo
Alessandra,
de OPS,
Stephanie, Aranza,
por todo su
all the
apoyo y al equipo de
PAHO team
intérpretes que nos
for
ayuda a eliminar la
their
barrera de
support, and the
idiomas. La verdad
interpreter
es un
team
gran
that helps us
limitante
with the language barrier, which oftentimes
a las demás personas
limitates us.
participantes les agradezco
They
mucho
are
que
a
nos hayan
fundamental
acompañado el día de
support
hoy
for us.
en este
To
webinar.
all the
Tuvimos
other
el doble de participantes
people,
que el año
all the
pasado.
participants who
Quizá el
were with
próximo año
us today,
seamos aún
we
más y
doubled
tengamos
last
oportunidad de
year's
escucharles sobre sus
participation. I
experiencias, en
hope we
particular
can
qué actividades han
continue
podido realizar en
increasing
sus respectivos
participation. We're very
contextos,
much interested
ya sea
in
para
getting to know
conmemorar el Día
your
Mundial de la Prevención de
experiences,
Ahogamientos o
your
para impulsar alguna de las
activities
acciones del
in
paquete para que
commemoration of the
tenemos la esperanza les resulte de utilidad
Drowning
para avanzar el
Prevention Day,
importante
but also
trabajo en
other
torno
things
al
you
desafío
do
que
to
todos tenemos delante
advance
de prevenir ahogamientos.
against this
Cuenten, por
challenge.
favor, con el apoyo de las oficinas de OPS en los
So
distintos
count on our
países.
support in
Ellos
the
están más que
different
dispuestos en
countries. They are
acompañarles en sus
more than
siguientes pasos.
ready to support
Unidos
you
para
on
cambiar
your
el
next
rumbo.
steps,
Para
united
nosotros queda claro
to
que cuando
change the
sumamos esfuerzos y
tide.
podemos
It's clear when
avanzar
we
mucho más
add
y de
up
mejor
or
forma.
and join all of our
Muchas gracias
efforts,
por el
we
favor de su
can
atención y que
progress
tengan un excelente
much
resto
better
del día.
together. Thank you very
Gracias,
much
Alessandra.
for your attention. Have an excellent rest of the day. Thank you, Alessandra. Thank you, everyone. Bye-bye.